5. Supporting employment through health and high-quality care for all. We want people to get the right health and social care support in the right place and at the right time to allow them to benefit from work, alongside good health. We want this care and support to start with the individual and meet their health and employment needs. We know that services don't always work well together. This can be frustrating for people, and they can miss out on support. We want everyone to work together to promote health and to prevent ill health. This includes patients, whom we want to empower to manage their own care. Promoting health. If someone is in work and has health problems, their workplace can support them quickly and increase the chance of them staying in work, which has financial and health benefits. Improving discussions about fitness for work and sickness certification. GPs can assess if a patient is fit for work and see if there is support which could allow them to stay in work, such as workplace adjustments or a phased return. The Statement of Fitness for Work, also known as the Fit Note, was introduced to encourage fuller discussions about work and health between GPs and their patients. Hospital doctors can also issue Fit Notes. The Fit Note can be an important tool in helping someone manage their condition, stay in work, or return to work. It can also prompt a GP to refer someone who would benefit to Fit for Work, a service where occupational health professionals give expert advice. Currently, the Fit Note is not always achieving its aim. It can be seen as a burden instead of a chance to provide support. Overall, decisions often don't reflect that an individual can work with the right support. We want a system where people get support to understand their health condition, the treatment they need, and how this affects their ability to work. It must be a system where healthcare professionals have the right skills and knowledge of health and work, act on their understanding that work is important for health, use Fit Notes well, and value the Fit for Work service. We will review how Fit Notes currently work and explore whether a wider group of healthcare professionals, beyond doctors, could issue Fit Notes. Questions. How can we make sure conversations between individuals and healthcare professionals focus on the work someone can do, especially in the early stages of an illness or condition? Are doctors the best people to provide information on work and health, decide whether someone is fit for work, and issue Fit Notes? If not, which other healthcare professionals should be involved? What information should be included in the Fit Note certificate to help support someone to return or stay in work? Is the current Fit Note right for capturing this information? Does it meet the needs of its users? Mental health and musculoskeletal services. Too many people with common mental health conditions, like anxiety or depression, or musculoskeletal conditions, like back pain or arthritis, fall out of work. Many of them end up on sickness benefits and do not return to work. Too often, services for people with common conditions aren't available when they are needed. The Improving Access to Psychological Therapies (IAPT) program has allowed more people to access services for common mental health conditions. We will increase this program further so more people have access to it. We will also more than double the number of employment advisors working in the programme. We will trial new approaches for musculoskeletal services that link treatment and employment support more closely and make it easier to refer people to the services. We will look to regularly collect data on patients with musculoskeletal conditions. Questions. How should access to services, treatment and employment support change for people with mental health or musculoskeletal conditions so that their health and employment needs are met in the best way possible? How can we help people easily find information about mental health and musculoskeletal services? Tailored and integrated work and health services. Occupational health and vocational rehabilitation support help keep people healthy and safe in work and manage risks in the workplace that may cause ill health. Currently, these services aren't joined up or easy to access, and they aren't tailored to individual needs. Some employers provide occupational health support, but not all. Many health professionals don't have expertise on occupational health. We want occupational health services to meet the different needs of individuals, whether they are employed but off sick, out of work, or self-employed. So, we propose to look at whether we can make some early changes to occupational health services. We would like everyone who needs occupational health assessments and advice to be referred generally as a matter of course, unless it is not appropriate or would be unlawful. We will explore how to join up occupational health services with the health and social care systems. Questions. How can occupational health services be organised so that everyone can access them and they are suitable for everyone? What is your experience of Fit for Work? What would a system that refers eligible people to occupational health assessment and advice generally as a matter of course look like? Integrating local health and employment support. We want health services and employment services to be joined up at a local level. This could mean a single service offering health and employment support, or linking up existing local services. Increasing data transparency. Sharing data can help us to enable people to stay healthy and in work. We will work with NHS Digital to collect employment status through healthcare datasets. We will work with Public Health England to develop measures of how well local areas are helping people to stay healthy and in work. With Public Health England, we will also look at how we could bring together evidence on work and health in one place for people to use locally when designing and delivering services. Questions. How can we encourage innovation through using local networks to improve health and work opportunities? How can we encourage employment status to be recorded across health services? What should be included in a set of work and health indicators for use at local level? How can we encourage people to share health and employment data? How should we bring together and share existing evidence so we can learn from it? Reinforcing that work can promote good health. Work promotes health, And this needs to be recognised by professionals in the health and care systems, disabled people, and people with long-term health conditions. We want to make sure training for health and social care professionals includes the benefits of work. To do this, we will work with Health Education England, professional regulators, Royal Colleges, and the Welsh and Scottish Government to improve the content of the training for medical and nursing training, further train current healthcare professionals. The National Institute for Health and Care Excellence, NICE, will consider work in their future clinical guidelines. In 2017, Public Health England will publish a report on the costs of worklessness, which will help local decision makers who are putting services in place. Questions. What is the best way to encourage those who put health and other services into place to recognise and promote work as a health outcome? Patients as partners. Patients and those who use services should be partners in their care. We can support this in different ways. We can give better information on how to find your way through the employment and healthcare systems. We can give people the option to refer themselves to services. We can improve people's understanding of how to manage their conditions. Digital services have a role to play here, and we are developing these with NHS England, including an app that lets people download their personal health records and a library of apps that will help people to manage their own health.